Tidelands Health has temporarily stopped receiving new vaccine applications. Today, I speak exclusively with the CEO of Tidelands Health, Bruce Bailey, for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Bruce Bailey, welcome to the award-winning Quintin's Close-Ups.
Happy to be here. Thanks for having me.
Yeah, you're welcome. I know that obviously you're the president and CEO of Tidelands Health.
Yes.
Let me ask you, I mean, there's so much going on right now, as you know. What is it like to be Bruce Bailey right now?
What's it like to be Bruce Bailey right now? It's an interesting time. We've been through a lot this past year, and so it's very rewarding to be Bruce Bailey right now, and to the extent, and in light of the fact that our team's done a great job in responding to the pandemic, kind of leaned in and ran to the emergency. And so we've done a great job this past year with all of our leadership, from our physician community all the way down to our nurses, to our vaccinators, to those who helped us with testing as this thing first started. So I'm very proud of our team and proud of what we've done. It's been challenging, and we've not had near the vaccine resources that we like to have right now. So today, that's probably the biggest challenge we have is, we've got a lot of people who are very happy and pleased with their experience with Tidelands Health who've gotten a vaccine, but there's still a lot of people out there waiting for a vaccine that we just don't have to give them right now. So deservedly so, they're pretty frustrated right now and anxious to get the vaccine. So that's a challenging thing if you're Bruce Bailey right now, is you'd like to be able to meet that need as it comes and get this vaccine into all the people who want it as quickly as possible. But we're just not able to do that right now. So that would be the challenging and frustrating part of the job right now.
Let me ask you this, Bruce. What vaccine logistics do you want to actually get from the state of South Carolina right now?
We've got the logistics figured out pretty well here locally. We've got vaccine capacity that we could probably do 5,000-6,000 a week. We're not getting that much vaccine. So the real challenge right now is just vaccine supply. And I don't know that it's anybody's fault. I think they're getting us the vaccine that they have coming into the state, proportionate to what we need in our community. But it's just not enough for those who are now eligible to receive a vaccine. So we've got a lot of demand from eligible groups, but we're just not getting the vaccine supply in fast enough to meet their expectations nor ours.
And as a matter of fact, let me go to WMBF in Myrtle Beach. They wrote this on their news website. They said this: Tidelands Health has made a decision to temporarily halt accepting new COVID-19 vaccination requests in order to catch up on appointments. Let me ask you, Bruce, how many appointments have there been altogether since the vaccine rollout?
When it first started and we opened up to 70-year-olds, I think we had 30-some thousand requests for a vaccine within 24 hours. It was really quite the demand. We're probably down to 15 to 20,000 left on that list, but we're only getting in about 1,000 vaccines a week for new doses. So you can do the math and understand how long it's going to take to get just to the 70-year-olds and get them completed. And now you've got the 65-year-old group that's eligible. So to some degree, it was a little overwhelming from our perspective to take even more requests for vaccines. So kind of halt, try to get the 70-year-olds done, and then we'll pick up the 65-year-olds.
How do you pick up when it comes to teachers when this particular debate is over with, and obviously the South Carolina General Assembly, the governor comes to some sort of consensus?
Well, we're following the governor's priority grid right now, and so we're here to be the custodian of and the administration of the vaccine. So I'm not going to dive into the merits of the teachers or not. Obviously, everybody needs a vaccine, wants a vaccine, but the supply is just so limited now that, DHEC and the governor have to create some kind of priority in which we're going to vaccinate people. So when they're eligible, we have a plan to get to them as quickly as possible and get the teachers vaccinated.
And the article from WMBF goes on to say this: when those 70 and older, as you mentioned, were able to start getting vaccines, the hospital system set up an online form that will put people on the waiting list. Tidelands Health would then contact the person when a vaccine appointment would become available. How many people were on a waiting list when the decision to halt these vaccines occurred?
Well, we're not halting for the 70-plus-year-olds. We have all of that list available. We're working that every day, scheduling the 70-plus-year-olds. We have the ability to schedule the 65-year-olds when that time comes.
Okay.
But we still need to work down the 70-plus-year-olds to make sure we're staying true to the governor's priorities.
And what is the general timetable for a vaccine appointment?
Well, it depends on how quickly you enrolled. So we are currently going through a process now of trying to give people a definitive date, the 70-plus-year-olds, when they can expect to get their vaccine. A little bit of the problem, Quintin, is predictability of vaccine supply. We really don't have a great forecast or insight into what we're going to get each week. That makes it hard to schedule, because if you expect 1,000 but you only get 500, then that changes the scheduling, and we don't want to have to reschedule people. We don't want to cancel. It's hard enough to get in touch with 70-plus-year-olds, get them scheduled, and then if we had to cancel and reschedule, we think that would just be very problematic, not only for us, but for that individual as well. So the predictability is really the key right now. If you'll just tell us what we're going to get every week, then we can schedule out and feel confident that we don't have to reschedule or cancel.
And you said this, quote, due to the extremely limited vaccine supply, we are only receiving about 975 first doses from the government each week. We temporarily halt accepting new vaccination requests on Sunday, February 7th. How many of those first doses have you all received since the government rolled out the vaccine?
We have vaccinated about 13,000 individuals between the healthcare workers, the first phase 1A,
right,
plus the 70-year-olds. So we've gotten it into about 13,000 people's arms, as they say. And so we've vaccinated everybody who's eligible and who's requested through the entire vaccine supply we've been given, and that's about 13,000 individuals.
And I know that I believe, if I'm not mistaken, reportedly the COVID-19 vaccine is available to individuals in phases. If I'm not mistaken.
Yes.
Okay. Well, let me ask you this, Bruce. Why are these stages, and why do people have to actually ask for permission to get the vaccine?
I think it's because of the limited supply. I think if there was enough vaccine to do everybody at one time, that's what we would have done. But because it is limited, it's being produced as fast as they can, but it's just not in sufficient numbers to meet everybody's demand who might want one. So they have to have a priority grid to get it out to the people that need it the most. And I think the priority first was healthcare workers, because they're caring for those who get sick. So that makes a lot of sense. And then after that, the most vulnerable communities, population groups would be the elderly. I mean, there's the statistics on who gets the sickest, who's getting admitted to hospitals the most. And it is the elderly with comorbid conditions, underlying conditions that make them more susceptible to the disease.
And with the halt of obviously vaccine appointments and extremely limited vaccine supply, as you mentioned, will that then stop you all from moving into further tiers or phases?
Well, it's all about the vaccine supply. The 65-year-old's the perfect example. I understand why they're the next group, and they probably should be the next group. But the vaccine supply is not there to vaccinate them yet. Again, we've not finished the 70-plus-year-olds. Don't have the vaccine to finish them out yet, but we've opened up the 65-year-olds despite that. So we've created some expectations of a group who really clamoring for the vaccine, but we just don't have the vaccine supply to meet that need yet.
And Tidelands Health also says this too on their Facebook page, quote, please know our Tidelands Health regional vaccination sites are fully staffed and prepared to administer 5,000 first doses of vaccine or more each week. How many sites are there throughout Georgetown County?
So we're operating one site in Murrells Inlet, here where I'm at.
Yeah.
The second site is in Georgetown City at the Howard Gym in Georgetown. So we've got two big sites that we are operating out of every week. We do support some of the DHEC initiatives with just scheduling and getting the word out. We're very concerned about the rural, underserved, at-risk communities, the minority communities. More difficult for them to know to go online and schedule for an appointment, access to internet, telephone. So we're working hand in hand with DHEC to try to get the word out and to make scheduling easier, working through the churches, the faith community. Sunday morning, we sent about a bunch of our employees out as volunteers to register people at church. Fill out a form, take a computer, get them registered and enrolled for a vaccine as best we possibly could. All of our community health resources are working hard with our community partners to get the word out and to try to find these folks and get them enrolled for a vaccine.
Where are those areas in the rural parts of Georgetown County that you're concerned about right now?
Really, the rural communities kind of west of the Waccamaw River, the intercoastal waterway, inland areas. That's where communities are farther away from the population centers, probably internet access, a little more limited. And, unfortunately, a lot of our processes are built around a website and the internet nowadays. And we realize that, and we know we've got to find ways to mitigate that for those who just don't have access to the tools necessary to go online and register. So we're working real hard to make sure we reach out to those communities.
Will you, and this is hypothetically speaking, will you be denied a request for more doses to open a larger vaccination site because of limited supply?
Denied might be the wrong word, but we won't be able to open that kind of site until we have more vaccine supply. We've had volunteers call. We've had government officials make known that they'll open up convention centers and football fields and parking lots. Sure. And we appreciate the effort and the offer, but until we have supply of vaccine that can support that kind of effort, there's really no reason to do that yet. Again, we don't have the vaccines that we need just to supply the two clinics that I described earlier.
Right. And will Tidelands request smaller allocations for now to ensure sufficient vaccine supply?
Pardon me?
Yeah, will Tidelands Health request smaller allocations of the vaccine for right now to ensure sufficient vaccine supply?
We're asking for all they'll give us right now.
Okay.
Again, we've got so many on our waiting list that if they would give us 2,000 instead of 1,000, if they give us 5,000 instead of 1,000, we take it because we have the need for it.
Yes, sir. And I know that those who are eligible for the vaccine can sign up to be alerted by email or phone when Tidelands resumes, obviously accepting new requests. The hospital believes that they won't be until late April or early May. So how are you guys preparing for that right now?
Well, we're building systems where we know who the 65-year-olds will be so that we can open that scheduling up to them when the time comes. We know how we'll communicate with them via phone or email to open that up for them to get an appointment at that time.
At that time. And let me ask you this. What is the current population right now in Georgetown County?
I think the total population?
Yes, sir.
65,000 total folks.
Oh, okay. And what data are you looking at when that will allow you to shift vaccine doses to? I thought that was my phone. But
sorry.
Oh, no worries. What data are you looking at that will allow you to shift vaccine doses to the rural areas of Georgetown County?
I wouldn't say that we're necessarily looking at data. We just know those communities need the vaccine. They're eligible now, so we know that we can vaccinate them if we can get to them and get them enrolled and get them to a vaccination site, whether that be one of ours or one that DHEC stands up in those communities. So we know that issue was there, so we're just trying to make specific efforts to reach those vulnerable communities.
Bruce Bailey, thank you so much for your time. And again, welcome to the award-winning Quintin's Close-Ups.
Thank you so much. Thanks for covering this topic and giving us a voice. We really appreciate it.
You're welcome anytime.